Housing Officer at Cernach Housing Association.
Caroline Jardine.
Emma McShane, Corporate Services and Assurance Manager at Cernach Housing Association.
I think we were a few months into the pandemic. I think people were beginning to realise that it wasn't just going to be the sort of 6-week, 2-month thing and then all back to work. So people, I think, were beginning to struggle to get used to this sort of like new temporary way of living. Probably by about the summer, it became apparent that we were going to have to do something to address sort of mental health, wellbeing, stress. That we decided that we wanted to do some work along the lines of health and wellbeing within the staff team, and you had been presented to us on a plate, as it were, so we went ahead and engaged you. The work that you did for us initially was a small piece of work to come in and to, I suppose, give us some sort of idea of where we were at that time, and what could we potentially do to address some of the things that people were feeling. But as we know, it grew, and you ended up working with us for a couple of years. So what you did for us was very varied, quite comprehensive, but yeah, probably quite straightforward as well.
So initially it was that you were coming in, you had individual set up sort of meetings with everybody, had a chat, what we were sort of looking to get from it, we were expecting it to be like. Then we had regular check-ins with yourself, we'd done sort of temperature checks just to see scoring how we were feeling. If the scores weren't great, you would then touch base with us again. You were always more than available, you always let us know. But it was good, it was easy, there was no pressure, it was all confidential, and you were contactable.
So I suppose as we started moving out of that, in the one-to-one sessions we talked a lot about kind of moving forward, just general wellbeing, general stress management techniques that you can take away with you through the rest of your kind of working life. I found that really helpful.
We just try to think of ways that would help to improve other ways that, like, being able to improve our health and wellbeing. So we started the walking group, and then we used an online website, and we selected where we were going to walk from, and we all got together and we all got given exercise slots throughout the day just to get up and sort of get out, because we were all working from home, things like that. So it just kind of brought us different ways of sort of networking and coming together and trying to break up just being in the house all the time. I would probably say knowing that maybe if you were starting to feel a wee bit under pressure or just not feeling yourself, that you could contact, or you could go, because I've got a wee chat with Seamus, it's laid in my calendar, and speaking to him tomorrow, or you knew that it was there if you needed it. And I think it was kind of good having an outsider as such, not your family, not your friends, because as much as you were going through it as well, your family and friends, you're a close-knit. Sometimes it's good to have somebody sort of impartial that's just there to kind of listen and maybe give you some hints and tips and advice and things like that.
As a staff member, it probably showed me that the organisation as a whole, it wasn't unnoticed when there was a particularly stressful time.
I think every organisation is going to have some sort of need for sort of health and wellbeing group, whether that's a small need or whether there are sort of deeper issues that have to be addressed. I definitely think there have been lots of benefits that we've had as an organisation, and Emma and Kirsty have highlighted some of these.